Today we're going to go over mixing insulin. The first thing you're going to do is you're going to make sure you've washed your hands thoroughly. Then you're going to check your order per the doctor on the MARS. I would next gather all my supplies and check the expiration dates. I have an expiration date on my regular insulin of 2024 and an expiration date on my NPH of 2024 as well. I have one vial of an NPH, one vial of regular insulin, my insulin syringe, which is in units, and then I have my alcohol swabs. The first thing you're going to do is take the NPH vial and roll it between your hands, making sure that it's mixed properly before administering. Then I'm going to pop off both the lids. And clean both of them with an alcohol pad for at least 5 seconds. Now, since these are new vials, you wouldn't technically have to do this, but just as a safety precaution, we would go ahead and clean them both. This is where, again, I would double check my order, which is for 20 regular and 20 NPH. Then I would go ahead and get my syringe ready. Before you do anything, you want to make sure you instill the same amount of units of air into both vials. So since the order is for 20 and 20, I will put 20 units of air into my NPH, and then I will put 20 units of air into my regular insulin. Uncap your needle. You're going to instill 20 units of air. Slowly pull out. And then my order's for 20 regular, so I'm going to instill another 20 units of air. And at this time, I'm going to go ahead and withdraw my first 20 units. Sometimes a little extra, so you can make sure you have all the air bubbles out, and then you can always release any extra you have. So I'm going to tap out any air bubbles. And go ahead and release any extra. And then I'm going to go ahead and take it over to my NPH and withdraw the next 20. Should give me a total of 40, which is what my order is asking for. Now on this one, you cannot take in any extra. Just still want to make sure you have no air bubbles. So I am at 40. I have no air bubbles. I'm now going to recap using my scoop method. At this time, I would have an RN come by and double check that I have withdrawn the correct amount of medication for my patient. And then I will go ahead and check my patient's glucose levels. And if the test results for my glucose levels shows that the patient is needing their insulin, I would go ahead and administer that insulin in the appropriate site. Once I have given this injection, I will make sure my patient is tolerating it well and wash my hands before leaving the room. I will now go back to my station and document what I did, as in the date, time, amount given, and what I gave, and that the patient is tolerating it well, and then sign it with my initials. And that is how you do a mixing of insulin. Thank you.